thyroid and Hashimoto's. In other words, we're going to be talking thyroidectomy. The doctor has taken my thyroid out, and I'm still getting symptoms. I'm assuming that's what the inference was in this topic that was requested. And we did something like this previously, in which we talked about Hashimoto's and radiation therapy. And so, but there's similarities. Again, we talked about it relative to radiation therapy versus thyroidectomy. But in a thyroidectomy, basically what happens is you've gotten Hashimoto's, you're getting hypothyroid symptoms from your immune system attacking your thyroid for so long. You're getting tired, fatigue, hair falling out, your gut's slowing up, your stomach's giving you acid indigestion, your constipation, skin is drying out, a number of things. And so then after the attack is taking place for a while, then you start getting hyper symptoms, you start getting anxiety, panic attacks, maybe even a big one is heart palpitations for no reason at all, arrhythmias, insomnia, night sweats, inward tremors. These are all hyper symptoms from the thyroid getting attacked, tissue being damaged, vomiting out a bunch of vomiting out a bunch of thyroid hormone, T4 and T3, and us getting jittery. So the person who's wanting to know about thyroidectomy or my thyroid's out probably went through this, probably got medication, and the medication didn't work. Maybe it worked, for a few weeks. Maybe it didn't work at all. Maybe it made the person worse. Maybe they kept switching one medication from synthetic to natural, and the whole deal, and nothing's worked. Your TSH is perfectly normal now, the gold standard TSH, T3, T4, but you still have all these symptoms, and you don't have a thyroid. And they told you it's no big deal. We're going to take your thyroid out. You're going to be hypothyroid, and we're going to manage it according to your hormone levels. Here's a problem. They're managing this. They're managing the thyroid. They're not managing this, the immune system. So the immune system's still there. They take your thyroid out. You might have antibodies. These are antibodies that are causing the immune system to attack your thyroid and create inflammation in your thyroid. Okay, these antibodies, maybe they're 500. Maybe the reading on them when they take your thyroid peroxidase enzyme test, maybe it's like 500. Normal 0 to 9, and they take your thyroid out, and it has less to attack. Maybe the antibodies clean up a little bit, but they still stay there. They don't go away. Maybe they go down to 200, maybe they go down to 50, but they're still there. They still have orders to attack, but there's no thyroid there to attack, correct? And I've through the years, I've read things and I've heard things that they don't always get the thyroid out. I can believe that. I've never read that particularly in medical literature. Medical literature makes it sound very clean. We take your thyroid out, we give you the medication, life is good. So that could be one reason that you still have thyroid tissue in there and the attack is still hitting. But I think the biggest reason is that you have other cross-talking tissues to the thyroid. What that means is it's called molecular mimicry. So there are enzymes in the thyroid that look exactly like enzymes on your cerebellum. That look exactly, I said enzymes. There are metabolites. There are metabolites on your thyroid that look exactly like metabolites on your cerebellum, which is the part of your brain that controls dizziness, vertigo, balance, stiff neck, blurred vision, a lot of that, okay? And there are metabolites on certain foods that also look exactly like metabolites on your thyroid. Weird, right? Foods, endocrine tissue, nerve tissue, but they have these metabolites that all look alike. So it's called a molecular mimicry, and when one thing gets attacked, like the thyroid, the other two can get attacked. So next thing you know, you have a food sensitivity, you eat that, it creates all kinds of symptoms of thyroid symptoms, cerebellar symptoms, gut symptoms, or or you get stressed, or you have some infection or something, and it flares up, inflammation, and it attacks your thyroid, your cerebellum, and maybe this food that you're sensitive to, and then it causes all those symptoms again. Well, when you take the thyroid out and those antibodies are still there, these two guys are still going to get attacked. And it goes beyond that, because they don't even know all the things that I was just reading about antibodies just this past weekend, and they don't even know all the things that that the antibodies are related to. They think it's related to rheumatoid arthritis. They know it's related to polycystic ovarian syndrome and things that are going on in your ovaries. They know it's related to parietal cell antibodies, which are antibodies in your stomach that gives you autoimmune gastritis. They know it's related to autoimmune hepatitis. There's more. It's related to they know it's related to celiac, and there's more, but that's enough. So the point is that you take the thyroid out, but you do something that flares up your immune response, and all of those things that are still there are still going to get tagged, because these antibodies that now have crosstalk with them are still there. So the solution is not to take out your thyroid. If at all possible, the first solution is to calm down your immune system, and by a variety of different things. Those of you who've been watching, we got 1,000 hours online telling you how we do that, or how that should be done. So that's the one thing. And probably one other thing is a lot of people want to know, is thyroid surgery better than thyroid radiation? I'm not a big radiation fan. I'm not a big fan of swallowing radioactive pills and putting them in my body and having them kill my thyroid. However, there are studies that show that long-term effects of thyroid radiation is not as good as long-term effects of having your thyroid out. So if that was anywhere in the interest of the person who asked this question or gave us this topic, overall, it's really that person's call. Thyroid surgeries can come with side effects, and as can the other. But the thyroid surgery has been shown to have a little bit more better outcomes longitudinally. And if you do thyroid medication, it works. That's better than those two. And if you get rid of your immune responses, it's better than all three of those. So that is Hashimoto's, thyroiditis, and a thyroidectomy.